Hi everybody. So today our topic is prediabetes and diabetes. We'll be getting into detail about the risk factors and we'll be answering this question today. Okay. So prediabetes and diabetes. A little bit of information about the diagnosis, about risk factors, and then we'll discuss new guidelines for screening for these two diseases, okay? So what is prediabetes? Prediabetes is when you go to the doctor and you want to just have a blood glucose level done because you know of somebody or you have somebody in your family who has diabetes and you're concerned, okay? So your blood glucose level comes back. The doctor says you may have prediabetes. You are on the borderline, so they could use either words like prediabetes, borderline, diabetics. They're kind of used interchangeably. So basically what that means is your blood glucose levels are higher than normal, okay? But they're not high enough to be diagnosed with diabetes, okay? So what is diabetes? Diabetes, on the other hand, is high glucose levels. They could be due to insulin resistance or insulin insufficiency. Usually in type 1 diabetes, it is insulin insufficiency due to pancreatic condition or disease. And in diabetes type 2 is a lot of times due to resistance, could be due to anything else. So either of those risk factors for them would be obesity and overweight. Okay, so we hear a lot of times that people telling each other, oh, don't eat a lot of sugar because it is going to give you diabetes. However, the strongest risk factor for diabetes is obesity and overweight. Overweight is defined as a BMI of 25 or more. Obesity is defined as a BMI of 30 or more. Other risk factors are age, so increasing age, which is non-modifiable factor, of course, and positive family history, which is also non-modifiable because you can't change that. A history of gestational diabetes, meaning a pregnant lady had a higher level of glucose in her blood during her pregnancy, polycystic ovarian syndrome, metabolic syndrome, and a sedentary lifestyle, okay? But the strongest out of all of them is obesity and overweight. How are these two diagnosed? We will talk about three measurements here. We will talk about HbA1c measurement, which is the glycosylated hemoglobin. I will explain that in a minute what it is and what is the function of measuring this. A fasting blood glucose level and a glucose tolerance test. Okay, so what is glycosylated hemoglobin or HbA1c? Normally, when you see a red blood cell, it has no nucleus. Okay, so it depends on the glucose in the blood for its energy flow. In diabetics, what happens is due to higher level of glucose in the blood, glucose gets combined or it attaches itself to the hemoglobin in the red blood cells and it builds up over time. Okay, so that's the key point here where it builds up over time, meaning that the measurement of HbA1c does not alter in acute settings. It does not alter with illness or stress in a short time. It gives us a measurement of how your blood glucose levels have been over the last couple of months. And other measurements that we use are fasting blood glucose and GTT. Fasting blood glucose levels are measured after a long fast, probably 8 hours or more than that. Usually it is overnight fast and measurements are done early in the morning before breakfast. And a glucose tolerance test is when the person is in fasting state you would give that person 75 grams of glucose orally in juice form and measure glucose levels 2 hours after to see how the body has metabolized that glucose. Okay, let's talk about values now. So HbA1c below 5.7 is normal for everybody. HbA1c between 5.7 and 6.4 is prediabetes. 6.5 or higher is diabetes. Okay, so 5.7 to 6.4 is prediabetes, and 6.5 or higher is diabetes. Fasting glucose levels 100 to 125 is prediabetes, and 126 or more is diabetes. For glucose tolerance test, 140 to 199 is prediabetes, and more than 200 is diabetes. Any of the two tests out of three, if they are positive for diabetes, this is diagnostic. Okay? So now we will talk a little bit about what the new guidelines are according to the United States Preventative Service Task Force. Okay, so who they are is also important to know. The United States Preventative Service Task Force is an independent panel. What they do is they take all the studies and all the information available over time and develop guidelines for screening purposes as well as preventative services. So they are helpful to provide us a guideline as to how we're supposed to screen certain conditions and how we're supposed to prevent those conditions and what we're supposed to give our patients as options for those preventative services. Okay. So previously, according to the USPSTF, they did not have a proper screening for diabetes or prediabetes. What they used to do was have a blood glucose level as part of cardiovascular risk assessment in overweight people or obese people ages 40 to 70. Okay, so they did not have an exclusive screening system for diabetes or prediabetes. It was just a part of cardiovascular screening. Now what they've done is they have formed a new screening recommendation for diabetes and prediabetes, and it is for non-pregnant, obese or overweight individuals between ages of 35 and 70. So the screening starts at 35 in obese or overweight individuals who are non-pregnant. Okay. For individuals who are pre-diabetic or diabetic, they are then given options to have preventative interventions, specifically for pre-diabetics because they are beneficial for them. So preventative information is supposed to be discussed with these patients, and they are supposed to be counseled about their condition according to the new guidelines as well. For people who are obese to the point where their BMI is more than 35, the USPSTF recommends offering multi-component intervention for prevention of diabetes in these pre-diabetic patients. Okay, so because this guideline is new, they don't know how often they need to be screened. So for now, what they're doing is they're using a 3-year interval period. This needs to be studied a little further, and they need to have better sort of interval given for screening so that these patients could be properly screened at proper intervals. Okay, so once the diagnosis for prediabetes is made, there are basically two things that you are given option to. Usually, most of the time, lifestyle modifications are major preventative intervention, and lifestyle modifications include diet and physical activity. So physical exercise to lose weight and diet to control weight is the most important point in preventative interventions, because they not only help you to lose weight and prevent diabetes from occurring in a pre-diabetic state, they also help you to lower your fat levels in your blood. They will help you lower your blood pressure levels, and they keep you healthier overall. Another thing that is also used for preventative intervention is metformin. Metformin is usually used for people who have been diagnosed with diabetes. However, in some studies, it has been used as a preventative intervention to see how effective it is in people. What they found out was that it is helpful in a lot of cases, especially with people who are obese with BMI of 35 or more, and if their age is 60 or more, and if they have a history of gestational diabetes. So it is quite helpful for those people. However, it is only helpful for lowering blood glucose levels, and it does not help with any of the other things, including weight, including blood pressure, and including fat levels in your blood. Okay? So overall, it just helps you to lower your risk, and it is only in specific individuals. So these are the new guidelines that I wanted to tell you. I hope you liked the video. Please give it a thumbs up and subscribe to my channel. Thank you.